my name is Nurse Sherry, and today we're going to be going over CNA testable skills. In order to obtain your CNA certification, you'll be required to do a skills evaluation exam, and that'll be between 21 and 23 skills depending on what state you're from. During today's class, we're going to be going over Credentia and Pearson view. And here in Colorado, we use Credentia. There are 23 skills, and 5 of them will randomly be picked. Today we'll be starting with skill 5, cleans upper and lower dentures. So the first thing you need to do is gather your supplies. So we'll need 1 emesis basin, we will need 1 toothbrush or denture brush, you will need some sort of denture paste. If you do not see denture paste in your skills lab, make sure that you ask your evaluator if you are supposed to use toothpaste since you didn't find any denture paste. Then you will need 2 clean towels, you will need a pair of gloves, and you will need your dentures with a denture cup and lid. So mine is attached, but if yours is not attached, you'll want to make sure that you have a lid for it. All right, the first thing we're going to do is wash our hands. So before you wash your hands, if you have sleeves on, you'll want to pull your sleeves up. You do not want to contaminate your clothes. So you'll just need to state, washing my hands. The next thing we're going to do is apply our gloves. You want to make sure you do this before you touch the dentures. You do not want to get any of mucous membranes or anything like that onto your skin. All right, the next thing I'm going to do is place my towel in the bottom of my sink. The reason we do this is dentures are very expensive and they can crack or break very easily if they're dropped into a sink. Also, if they're put into the sink, you could get them contaminated with anything that's in the sink. So the towel is a really good idea. An alternative to the towel is a paper towel that you could use. I personally like the towel because it's thicker and it would hold more if I did end up dropping them. All right, so the next step we're going to do is turn on our water. So if you have a water setting with 1 handle, you'll want to put it in the middle. If you have the 2, you're going to turn them both on. Wait a second, feel the water just to make sure it's not too cold or too hot. It should just be lukewarm. And the next step I'm going to do is grab my toothbrush. I'm going to rinse my toothbrush, which you need to do. And then you'll take your denture paste and you'll just put a little dot on there for the evaluation. And it's about pea size. All right, I'm going to lay this down on my clean surface. I'm going to open up my lid and grab one of my dentures out. So my first one I'm going to do is my top denture. So my upper denture, the first thing you got to do is rinse them. And you need to rinse them carefully so that you get all of the surfaces. So I want to make sure that I move my hand around so that I'm actually rinsing every area of it. Next, I'm going to grab my toothbrush, and a critical step is cleaning every part of the dentures. When you look at this dip here is a lot where people will put like Fix-A-Dent or anything that will help it stick to the top of their mouth. And so that's where you might see a lot of gunk. So you really want to get in there and make sure that you get all of this area. Then I'm going to flip it over and I'm going to do the teeth, the bottom of it, the sides, and then I got to move my hands around to get all of the areas. Then you will need to rinse this one out. And make sure that you get all of the toothpaste or denture paste off of it. And then you will put it on your clean, dry surface. The next thing is I'm going to grab my lower dentures and I'm going to rinse them off. Another critical step, making sure you're rinsing them off and cleaning every surface. With these, this little dip right here is where some of that stuff will get stuck, either food or maybe some paste that they use to put these in. Flip it around. I'm going to get inside here. Make sure you get every tooth. And then make sure you get the outer portion. Once you had made sure that you've gotten all of it, then you will rinse these out. Moving my hands around to make sure I get every portion. And then I will lay these on my clean surface. Next, I'm going to rinse off my toothbrush and I'm going to place it in the emesis basin. When you place it in, your bristles will need to be pointing upward. If they aren't, you could get a point taken off for that. Now I'm going to take my old denture water, which is dirty, and I'm going to dump it in the sink. I'm going to rinse it out, making sure I get the lid, the outside, and then I'm going to replace the water with clean water. Sometimes they have a solution they may want you to put in, and that's fine too. Then I'm going to take my dentures and I'm going to place them neatly back into the denture container. I will close the lid. Then I'm going to turn the water off. I'm going to take my 2 towels that are now dirty and I'm going to put them in the dirty linen utility. Then I'm going to take my supplies and I'm going to take these back to where I got them. So wherever they may have a table up, but wherever you got them, you're going to take them back to that. After you do that, you will need to remove your gloves without contaminating yourself. So make sure you grab the glove in the center. This is the proper way to remove gloves. And you're going to pull that off and you're going to scrunch this up into your hand. Then you're going to take 2 fingers and put that under, because underneath is clean, right? And we're going to pull that off. Now all my dirty is down here inside of it, so it won't be outside of it. I'm going to dispose of my gloves in the trash can. I'm going to wash my hands, and then I will document, and I will state skill complete. As always, thank you for watching my channel. I will have links to Credentia and Pearson in my links below, along with the PowerPoint that I have with all the instructions. Thank you. Please subscribe.